All right, County Judge Clay Jenkins is in by his position with Dallas County in the leadership process. He leads the Homeland Security and leads this really entire Ebola containment investigation operation. You're not making all the decisions. He told me earlier he's deferring to some of the experts, but he's in studio for his first reporter interview of the day, because this is really the first time you've had a moment to catch your breath, right? It's been a busy, busy day.
Yeah, we've been busy with the work behind the scenes from the time this broke up until the press conference today, and then you're the first reporter I've talked to one-on-one, because we're setting up an incident command system.
You've got a structure in place now to handle everything, and you don't need to assign all the spots. We don't need to know how it works, but explain, I guess, that you're able to gather information and disseminate information, and that's probably the best part of it, right?
That's right, and we're bringing in people from the city of Dallas, from DISD, from our county departments, and one of my staff, the Chief of Emergency Management, who reports directly to me, will be the incident commander. We'll get all that information in real time. We'll get those out to people like Mike Rawlings and Mike Miles, who've done a great job of letting the public know that this is a situation that they need not be alarmed about. It's a serious situation, but we've got the best minds from the CDC, the state, and the local experts working seamlessly together on this, and we're improving that through this incident command.
Let's talk about CDC. Technically, again, they answer to you. So what are they doing tonight? What are they working on?
Well, they're working on a host of things. So the CDC tomorrow will begin to embed in my emergency operations center with some of their team. Some of their team will be at Presbyterian, some of them will remain there, and some will be moving to our emergency operations center. They're working on a variety of investigations. Other county agencies, the Sheriff's Department, other agencies, as well as the great job our Health and Human Services are doing, they're working tonight. I was on a call with people from DISD and the City of Dallas right before your show tonight.
So we can debate what happened at Presbyterian, and it has been on the news coverage, but what happened has concerned a lot of people. They know that they were trained and they were told, that everything's in place, and now, so there are people who are scared. And you're saying the follow to that might be nobody goes to that hospital. And actually, you said people are going to die if that happens, but not from Ebola.
That's right. Here, my big fear is that people will do two things: that they'll quit using a great hospital in Presbyterian in the short term because they'll be afraid that there's Ebola there. What I said, the clip was a little cut off earlier, but there's zero chance of getting Ebola from merely going to the same hospital where a quarantine patient is being treated. Presby's a great hospital. If there's a dip there, or if people begin to have any symptom at all and they just start going to emergency rooms thinking they might have Ebola, then the very real illnesses that our emergency rooms are clogged with every day will be delayed longer in being treated, and that's where we could see some bigger chance of casualties and bad outcomes. So we're going to get you the information. I'm here tonight on 2 hours sleep to get you the information. Mike Rawlings has been doing the same thing. Right. Mike Miles. We're going to get you that information, and we're going to be honest with you, about what's going on. And people just need to trust us. We're good at this. The state is good at this. Locally, we're good at this. The same people that worked on West Nile virus.
Can I interrupt you? Sure. There's a level of distrust, and I heard it even more when this guy went to the hospital and was released, because everybody had heard there had been training. There's a level of distrust. Are you going to try to stop that level of distrust? Because there's a level of distrust.
I'm going to earn again, and we in this community, the leadership of this community, are going to earn again their trust, like we did with West Nile virus, like we have. David Lakey, who's coming from Austin to be the state's person, is the person who helped save Parkland Hospital when we were under the probation, the federal probation there, and he's the person who was by my side for West Nile virus. Dave Daigle from the CDC is the same person who was by my side in my office for West Nile virus. We're going to earn their trust. We're going to get this contained and stopped. It's isolated, it's contained now, and it's going to stay contained.
Last night, County Health Director Zach Thompson, who says he's not political, said that he thinks a moratorium on flights out of Western Africa ought to happen. You say you're concerned about the health of the citizens of your county. He says he is too. And last night he says a thermometer in the mouth isn't cutting it, basically, as that's the investigative measure that's happening over there. You are political. You've hosted the president. Are you going to ask for a moratorium? What are you going to do if your health director wants it? People, he felt, are not being served health-wise in the county. What are you going to do? Will you ask for a moratorium when you're president?
That's something that they're looking at now. They're looking at beefing up those health protocols. They've been briefed by the CDC on what they're recommending there. It's not actually a CDC call. That there's other agencies, the FAA and other agencies that come into play in that. I'll have an opinion on that after I get all the facts on that. But right now, we're drinking from a fire hose, and what I'm focused on is incident command of the situation on the ground here in Dallas County.
You're communicating with the White House. Do you have a level of familiarity or respect that you can say, this ain't working?
Sure.
This ain't working. Whatever you want to spin out there, or however it's handled, whether it's good or bad, this isn't working. We need more help. We need it now.
We are candid in our conversations, and I've been assured that we have the best team from the CDC here, and that if we need other assets, that they'll be here. So this has the attention of the White House, it has the full attention of the CDC, and I guarantee you it has our attention.
All right, Clay Jenkins, thanks. Good
Thank
luck
you.
over the next few days.
Thank
Thanks
you.
for coming.